Alright, coronary artery disease, also known as CAD, ischemic heart disease, coronary heart disease, is the narrowing of the heart arteries and reduce in blood flow, causing cell death, myocardial infarction, or heart attack. And TCM, we call it chest pain or chest B, like B syndrome. There's a deficiency types, usually in the old age or those with weak kidney qi. And then there's the excess type, those with qi stagnation, blood stasis, cold, and phlegm. The symptoms are shortness of breath, dizziness, palpitations, fatigue, cold hands and feet, pale complexion, sweat easy, chest pain that radiates to the left shoulder and arm, and purple tongue. And TCM is identified as heart-yang deficiency, spleen and kidney deficiency, qi stagnation, and blood stasis. So the treatment is standing with the type of Qigong is you're going to be standing with the thumbs and middle finger touching, and visualize you're on a beach and there's a sunrise. So visualize expelling evil qi from the bottom of the feet, the yang chun point, and then visualize white sparkles on heart 4. So heart 7 is here, and those are about half a chun apart, 7, 6, 5, 4, and visualize white sparkles coming out, okay, and PC8 as well, the Lao Gong, with the thumb and middle fingers touching. Then you're going to do lower conduction at CV1, the Hui Yin. You conduct the qi down the legs, the front, sides, and back, out the yang chun point, kidney 1, and the little toes. When it comes to the upper conduction, you do PC8 and heart 8 outside the left arm and hand creating a circuit to the inside. So from the left arm outside, it comes to the inside of this arm. So you visualize qi circulating in that way to the Rin 17 or conception vessel 17 between the nipples on the sternum. And then you repeat that, but you go from the outer right arm to the inner left arm. And then you close with Dantian, and then you continue on and do the relaxation Qigong. So obstruction of yang in the chest is one of the type of CAD issues identified in traditional Chinese medicine. The symptoms are angina pectoris, that's chest pain from ischemia and poor blood circulation. There's a sensation of suffocation radiating to the left shoulder, pale nails, purple lips and tongue, tongue with white or greasy coat, a pulse that's wiry or thready and slippery. So you do the coronary artery disease Qigong, as we just described. You can do Badwa Jin number 1, 4, 6, and 7, and then 6 healing sounds with the emphasis on the he sound, which is for the triple burner. The other coronary artery disease relationship with TCM is deficiency of the yang qi. That's typically you have a dull chest pain, stuffy chest, shortness of breath and dizziness, palpitations, fatigue, lassitude, aversion to cold, cold hands and feet, pale complexion, sweating doing physical things, pale and swollen tongue with teeth marks. The pulse is deep, thready, or knotted. So anytime there's yang deficiency, there's always cold. Cold hands, cold feet. They don't want to be cold. So the prescription is doing the coronary artery disease Qigong, the longevity health Qigong, and then the Roberant Qigong. And then you can do the Yi Jin Jing Qigong for strengthening, and then the relaxation Qigong. Alright, let's stop there.